PMDD, what is that? Let's break it down right here and right now. The P and the M stand for premenstrual. So this is a time period that occurs about 1 to 2 weeks before you menstruate or you have your period. Dysphoric is a state of unease, generalized dissatisfaction with life, feeling unhappy or unwell. Disorder is a lack of order. Things are not where they should be. A state of confusion, disrupting the arrangement of your body. This can be both physical symptoms and mental symptoms. Basically, PMDD is a much more severe form of PMS. PMS on steroids. It is chronic. It lasts a long time. Basically from the time you start menstruating to when you stop menstruating. You experience the similar, if not the same, symptoms at every point in your cycle, which is usually in the second half of your period. So between ovulation and menstruation, or the luteal phase, the I'm losing my mind phase. And like clockwork, every month, you feel like rage. 3 to 8% of menstruating women suffer from this disorder. Doesn't seem like it's that common because I don't know very many people that suffer from PMDD, which is why I am doing this video, is because I am looking for you. Do you suffer from PMDD? If so, comment below and become my new best friend. I need more friends. So, do you suffer from any of these symptoms? Because if you do, you might have PMDD. Lucky you. But there's good news, because these symptoms will resolve when you have your period. So if you find yourself saying, yes, I can't wait for my period, then guess what? You probably have PMDD. This condition can affect relationships, disrupt your routine, and basically just change you into a person you don't want to be. So, during the second half of your period, or whenever, are you severely tired and unmotivated, exhausted, fatigued? Do you have mood changes? Like suddenly you feel irritable, angry, impatient, or nervous? Anxiety leading to panic attacks, worry, which can lead to insomnia, or sometimes you can sleep too much with PMDD. Do you get extremely sad and cry over things that you normally wouldn't cry about? Hopelessness, difficulty concentrating, critical thoughts, negative self-thinking, depression, or suicidal thoughts. You can also have common PMS symptoms. So like breast tenderness, bloating, appetite changes, food cravings, binge eating, headaches, migraines, or just feeling overwhelmed. Just overwhelmed. Like, I can't do this. I can't do that. I can't go because I don't have anything to wear. I'm uncomfortable. I don't want to be around people. I'm going to kill him. I'm going to strangle him. That's what PMDD is like. 2 weeks out of the month, you're cool. You're calm. You're great. You're sociable. You're fun. And then after you ovulate, watch out. Totally different person. But good news, hey, when you menstruate, you're going to be normal again. You're going to be good again when you menstruate. And then hopefully when you hit menopause. This is usually a self-diagnosable condition. So if you checked any of the boxes, congratulations, you might have PMDD, which is actually a good thing because once you figure out what it is that you have, you can figure out how to treat it. So I would encourage you, if you think you have premenstrual dysphoric disorder, to go talk to your doctor and get a diagnosis. So hi, my name is Jennifer and I have premenstrual dysphoric disorder. I have struggled with this disorder since getting my period. When I was 14 years old to now, I've struggled with it for at least 25 years. And only until about 2 years ago did I even have an inkling that something was wrong with me. I thought I just struggled with depression here and there, but I started charting my cycle and seeing that every month I would start off getting irritable and impatient and angry, and kind of for no reason, or maybe a reason, but the reason really wasn't something that I needed to get angry about. So I blow things way out of proportion. Then it would progress into anxiety. I would start worrying about things that I didn't really need to worry about. I would not sleep and not sleep and not sleep. So I would struggle from insomnia. Then I'd also get migraine headaches, like really bad migraine headaches. One side of the head. The doctor would ask me, so on a scale of 1 to 10, how bad are your migraines? 10 being the worst pain of your life. And I remember saying 22, like it was that bad. I would call in sick to work. I would want to stay in bed. I was unmotivated. I didn't want to do anything. Then it would lead to critical thoughts, negative thinking, and just depression, just a horrible hopelessness. And I would cry. I would definitely excessively cry about things that in my normal follicular phase would not bother me. So I have a range of symptoms. If you have any of these symptoms, if they ring a bell, let me know in the comments below. What symptoms do you have in your PMDD? Is there something that I didn't cover? I'm very fortunate that I don't have a lot of physical symptoms or more mental symptoms, but I would get breast tenderness. So my goal for doing this video is to just put myself out there, air out my dirty laundry so that you can just have a hoot and holler. The goal of this is to create awareness for PMDD and establish a community of people with PMDD. So I'm hoping that this place will be a place of encouragement and inspiration. So if you'd like to come along with me, hit that subscribe button. And come on, let's go. Let's do this. And if you don't want to, that's fine too. If it's too much for you, don't hit the subscribe. Just get out of here. Don't worry about it. So if you found this video helpful or interesting in any way, please hit the like button and let me know. Let me know in the comments below who you are, where you're from, how long you suffered with PMDD. Anyway, thanks for watching. Have a good evening.